and thank you for joining us today. Today's discussion is about obsessive-compulsive disorder known as OCD. Today, I'm honored to have Dr. Nadia who will share insight on this topic. Before we start, can you tell us a little bit about yourself?
Hi, everyone. My name is Nadia. I am a queer and non-binary Palestinian-American clinical psychologist. I'm an educator and a speaker, and I'm based in Washington, D.C. And my practice is called Beyond the Binary Psychotherapy and Consulting, where I collaborate with LGBTQ plus Arabs, WANA, IPOC, and first-gen and second-gen immigrant clients to explore a bunch of different issues. So thank you so much for having me here today.
Thank you for sharing. To start off, can you tell us about OCD and what are the common symptoms that people should be aware of?
Yeah, absolutely. So, like you said, OCD stands for Obsessive Compulsive Disorder. And there are really two main components or symptoms of OCD. And that's the presence of obsessions and compulsions that significantly interfere with one's daily life. So, I want to explain a little bit about both of those because I think there's a lot of misconceptions about what obsessions and compulsions are. So, everyone experiences intrusive thoughts throughout their life. Sometimes it can be strange, it might feel irrational, something just kind of pops in your mind, but you're able to kinda let it go. So you might be driving over a bridge and have the thought of like, "Oh, like, what if I just drove off the bridge?" Right? But you kinda let it go and it doesn't bother you much throughout the rest of the day. But obsessions, on the other hand, are persistent, unwanted, intrusive thoughts. They can be intrusive images or even urges that trigger extreme distress, anxiety, discomfort, or strong negative feelings like disgust or fear. And they keep coming back. Obsessions can also center on various themes. And not everyone will, there are a bunch of different ones, but not everyone will experience all of the same obsessional themes or obsessional content. But you might hear of themes such as contamination, religious obsessions, obsessions related to responsibility, related to one's identity, related. Sometimes there are sexual obsessions. So there are a bunch of different sort of themes or categories of obsessions that exist. And they oftentimes take the form of a doubt. So, like a what if statement. And I'll give some examples of some obsessions that one might have. So, what if I ran over and killed that person while I was driving and didn't realize it? What if I accidentally poisoned the kids that I'm babysitting? What if I have a disease, I don't know about it, and I'm spreading it around to everyone unknowingly? What if I'm in the kitchen? What if I just pick up this knife and stab myself with it? What if I'm not praying exactly the right, perfect way? What if I didn't lock the door when I left the house? What if I left the stove on and the house burned down? What if I just called that person a horrible word? So those are some examples, but it could also be something like a violent or explicit image that could be intrusive into your mind and you don't want it there and it's really, really disgusting. So if you're listening to some of these thoughts that I've just shared, you might think, that kind of seems irrational. Like, why would I do that? Why would I have accidentally run over someone and not known and kind of driven away, right? That doesn't sound like me. But to someone with OCD, these thoughts and obsessions, they feel incredibly real. They feel like real possibilities and they just won't leave the mind. And obsessions cause us to doubt our true selves, who we know ourselves to be, what we know our true values are. And there's this extreme fear of maybe us becoming or doing something really harmful. So the thoughts are incredibly distressing. They're invasive. They feel relentless and just so uncomfortable. And they also take up a lot of time and really get in the way of us living our lives. So like I said, a lot of folks with OCD actually when they're not sort of in the heightened state of anxiety from their obsessions, may be able to say like, okay, I can rationally understand that these obsessive thoughts aren't real or that they don't make sense. But the felt sense of them it is really real. This felt sense is like, okay, there is this immediate threat. These thoughts pose really intense, horrible realities, and I have to sort of protect myself from that happening. And OCD is really good at sort of tricking us into believing that there is this real danger. And so we want to do whatever we can to prevent that from happening. So because intrusive obsessions cause extreme discomfort, folks with OCD develop compulsions. And compulsions are repetitive behaviors that in very temporarily relieve the anxiety and the distress from the obsessive thoughts. So someone with OCD feels like they have to do a compulsion even though they don't want to, or something bad will happen, or they won't be able to handle the discomfort from these intrusive obsessions. So a compulsion can be like an observable behavior. So something like checking that you locked a door or that you turned off the stove multiple times, even though you know that you've already done that. It could be excessive washing and cleaning, putting things in a very, very certain order until it feels just right. Or it can be something a little more internal. So it could be constantly replaying conversations in your head to make sure that you didn't say something offensive, or counting to a certain number before you allow yourself to do something, or repeating certain mantras over and over and over again internally. So they can be more internal, they can be more observable. So after someone with OCD performs a compulsion, there's this sense of like immediate relief, but it's very, very short term. And it's a bit of a cycle. So we have this intrusive obsession, intense anxiety, and then a compulsion to kind of relieve that anxiety just for the moment. And that's where folks kind of feel better. But with OCD, the obsession inevitably returns. The anxiety spikes again, and the person engages in that compulsion again. So, in the long term, continuing to respond to obsessions with compulsive behaviors actually makes OCD um, more intense and makes it feel worse. So, your mind is learning and believes, okay, so if I don't do this compulsion, I can't handle this anxiety and something horrible is going to happen. This fear, this doubt that I have is going to come true. And it just becomes this really distressing cycle of obsessive thoughts, anxiety, compulsion, and really temporary relief. And it just keeps continuing. So the more you engage in compulsions, the more they grow and expand over time. So someone might start by washing their hands maybe 3 times or 4 times, and as you keep doing it, it keeps expanding to more and more times, and then also your sort of like, the number of compulsion the number of types of compulsions you're doing could expand too. And compulsions are also often paired with avoidance. So a compulsion might be something you're doing, but you also might avoid things that could trigger obsessional thoughts, places, even avoiding thinking about certain things because you're worried that might bring up or trigger OCD and then trigger sort of like having to engage in some compulsions. So I also want to give some examples of compulsions. So using some of the ones I mentioned earlier with obsessional doubt. So if I had the obsessional thought, what if I ran over and killed someone and didn't know about it? I might constantly be checking in my rearview mirror as I'm driving. Or I might turn around and go back to just check that there wasn't, a person or like an animal back in the road that I passed. If someone's driving with me, I might constantly ask them for reassurance. I didn't hit someone, right? I didn't hit someone, right? I'm thinking about the babysitting example, right? What if I accidentally poison the kids I'm babysitting? I might check that they're not developing any symptoms. I might check that they're breathing. I might not touch any of the food that they're eating. When I leave, I might constantly be ruminating internally about whether or not they're going to get sick or whether or not they're going to die. Let's see. What are some other ones? Oh, the one where I said, "What if I pick up this kitchen knife and stab myself?" Right? I might repeat mantras in my head to prevent me from stabbing myself, or I might avoid using knives or cutting things, or even going into the kitchen altogether. If I'm not praying just the exact right way, I might redo prayers over and over and over and over again until it feels just right, or maybe even engage in excessive confessions to people or religious leaders about just very minor things. I think one of the ones that might be really familiar for folks in terms of like pop cultural understanding of OCD is like checking that you locked the door multiple times or that you turned off the stove, things like that. And, it also might be something like, if you have a violent image pop up in your mind, you might walk through a doorway 10 different times, right? Until you do that, then that image is going to be there and there's going to be a lot of distress. So, these are some examples of some of the more observable um, compulsions and some of the more internal ones where you're kind of talking or thinking or performing kind of mental rituals. And these are just some examples. And it's important to remember that compulsions are repetitive. So it's not just something that we're really doing one time. That's the nature of the obsessional thoughts or the doubts is even if even after you know that you've checked the stove and it's off, OCD is gonna come back with, "Okay, well, what if you didn't? What if you actually did it? I know you're looking at the stove and you're seeing that it's off, but what if it's not? What if when you turn your back, it turns back on?" So that's what kinda, like, maintains the checking, um, behavior. So that's I know that was a lot, but I think those are the 2 main parts of OCD, and I think there is a lot of misconception about, what those 2 pieces actually are.
Um, what are some common misunderstandings people have about OCD, especially in the Arab communities?
Sure. So I think one a really common misconception about OCD is that "Oh, I'm so OCD," or "That's just my OCD because I'm super clean or I'm super organized." People joke a lot and saying things like that, like, "My OCD is kicking in," because they just want things a certain way. And that, is very different than what I sort of just described about someone's experience with OCD. So even just saying something in passing like that can actually be really harmful and invalidating and reinforce a lot of shame, because the actual experience of folks with OCD is very, very distressing and it's impairing. It's not just like a quirky personality trait about liking things to be organized. I think along the same lines, when supporting a loved one with OCD, we see someone that we care about in a lot of distress. And until they complete the compulsion or the ritual, that distress is really, really heightened. And so, a lot of times, loved ones or family members will actually help someone complete a compulsion or help someone engage in avoidance because it helps calm them down in the moment. And I think that that's done as an act of love because you see someone that you care about in a lot of distress, but that actually kind of feeds into the OCD cycle and keeps it maintained and keeps it going. On the other hand, folks just might not understand really what the internal experience of having OCD is like. And so there can oftentimes be a lot of criticism or judgment for, why are you thinking like this? Like this is so irrational, but the person really can't help it. It's part of OCD and that's what's driving some of these thoughts. So there can be just a lot of misunderstanding of what that internal experience is like. And like in most communities, in Arab communities, there can be a lot of shame or stigma around mental health in general. And the content of obsessional thoughts are oftentimes like folks feel even more ashamed or embarrassed. We don't want people to find out the content of our obsessions. We don't want people to think we're bad people for having these thoughts that we can't really control or that there's something wrong with us. And I think too, something that comes up, in Arab communities, especially if folks are, religious, is that OCD can center around religious themes, and so it can sometimes get missed as just sort of part of typical religious practice. However, if your religious practices are taking a lot more time than is typical within your community or are causing you a great deal of internal distress, if there's a lot of fear and doubt and anxiety that's coming along with these practices. You feel like you're not getting it right, you can't get it right, and if you don't, something horrible is going to happen. It might be helpful to check in with a mental health professional who can help determine if OCD fits and then how you can still engage authentically with your religious practice while managing OCD.
How can OCD affect someone's daily life, relationship, or ability to stay focused, especially when it left untreated?
So the compulsions and the obsessions take up a lot of time. So it can really prevent people from engaging in meaningful activities, from going places and being with people that they love. It can actually be quite isolating because not only the time, but the fear and the anxiety spreads to a lot of different areas, and so to prevent fear and anxiety from coming up, folks avoid a lot of things. And OCD takes us out of the present moment. It keeps us stuck in a cycle of anxiety. So we miss a lot of what is actually going on around us that impacts our relationships and our ability to be present. It can also be really difficult to concentrate at work or at school or at home. It can impact your mood. It can cause irritability because you're constantly activated with anxiety. Um, and OCD can also range in severity and impairment, and this can also change across life. OCD is typically thought of as chronic, so you will be managing in some way throughout your life, and you can be at points where it feels like it's not really kind of bothering you at all. And then at other points in your life, maybe where there's a lot of stress, it might sort of come back on a little bit more intensely. Um, some folks are able to manage symptoms in an outpatient setting. Some folks might need to seek inpatient care if their symptoms are a little bit more severe. And again, that can also shift across the lifespan. And something else I think that is important to mention is that sometimes OCD gets mistaken for generalized anxiety or depression or something else. And so folks might actually be seeking therapy for another issue. And then through talking with a therapist, they might kind of listen and say, some of the thoughts on the anxieties you're mentioning or some of the behaviors that you're mentioning actually kinda sound like OCD, and so diagnosis actually might even be delayed because folks might not recognize, what's coming up, or there might be a lot of shame around, um, their internal experience, so they don't share about it, uh, right away.
What would you say to someone who thinks that their habits or thought might be a sign of OCD, but isn't sure if they should seek help?
So the first thing I wanna say is just please remember that there's nothing wrong with you. OCD is incredibly challenging, and it can be really scary, especially at the beginning when you might not have, this knowledge of what OCD is, what it looks like, what it feels like. So it just can be really, really scary, especially when you're doing it alone. But we have therapies and we have treatments that we know can support you in feeling better and getting back to doing the things that you love. And OCD is more common than you think, so you're not alone in this experience. It's something that a lot of folks go through. So even if you have like 1% inkling that something might be going on, please reach out to a mental health professional or a loved one or someone you trust to help you get connected to someone who is trained to assess and treat OCD or someone who can help you get connected to those who are. It's really important to connect to mental health providers who have OCD specific training because OCD treatment is different than other types of anxiety or other mental health conditions. So, I'm gonna, I guess, ask you to link my info in the show notes. So if anyone has any questions or doubts about seeking care, I really, really invite you and encourage you to reach out to me, and I'm happy to help you get connected.
What are the treatment options for OCD, and what is the first step someone should take?
So there are several different therapies that are really helpful for OCD. I would say the three kind of like big ones. The first one is exposure and response prevention, or ERP. Then we have acceptance and commitment therapy, sometimes written as ACT, and then there are inference-based therapies, sometimes, called ICBT. So those are some, common psychological treatments for OCD, and all of these therapies have a similar goal, which is to break the obsession, anxiety, compulsion cycle by learning how to stop completing and engaging with the compulsion. That is really what maintains the anxiety. So they each have different ways of doing that and in supporting folks to break that cycle. ERP, exposure and response prevention, is backed by the most research. There's the most information out there about it. ACT is very widely studied as well. Inference-based therapy is a little bit newer. However, I really, really like that, and I think it's incredibly helpful. I've seen folks like really make a ton of progress with inference-based therapy, especially if you've tried another type of therapy for OCD and you're looking for a bit of a different approach. And there are also medications. So you can do therapy without medication. You can do medication without therapy. You can do both at the same time. It's really just about sort of where you are, how OCD is showing up for you, and how it's impacting your life. So it's really important to get connected to a treatment team who can help you make an informed decision and kind of tweak your your treatment plan as you're moving through care. And the first step is really just kind of seeking out support. So you might even talk with your primary care doctor. They are a really good way to get connected to mental health care. Or there are a lot of different um, directories online. So a lot of folks have heard of Psychology Today. That's probably the most well known one. But there's also a really great directory called Inclusive Therapists, and you can search by provider identity too. So if you're looking to get connected with an Arab therapist or a Swana therapist, like we are out there and we're so excited to connect and support folks. And like I said, please reach out to me if you have any questions at all.
Is there any final message or advice you'd like to share with people about mental well-being and taking care of themselves?
Yeah, yeah. So I love working with the Arab community, and so I really want to talk directly to and encourage our Arab American siblings to seek mental health support if you are struggling. By taking care of ourselves, we make our families and we make our communities stronger. Your mental health matters. So, as highlighted on the various episodes of this podcast, which are amazing, there are Arab therapists who understand our culture and experiences and want to support our communities in living meaningful lives. So, if you're even thinking about seeking help, please, and you don't know where to start, contact me. Please reach out.
Thank you for taking the time to being our guest.
Yeah, thanks for having me.